Hi guys, I'm Dr. Crystal Maxwell, and it has been a little while since I have last done a video, but today is Father's Day, and I was just compelled to hop on quickly and share some of my thoughts about what I've been seeing over the last month or so since my last video. So we're in the midst of reopening. Here in South Carolina, the past 2 days or so, we've had over 1,000 cases, new cases of COVID-19 each day. Numbers have continued to rise instead of go down, not only in South Carolina, but other states around the country as well. And it's very saddening. It was very saddening to go and pick up a Father's Day lunch for my husband, and I was literally the only person at the restaurant with a mask. Greeters had no mask. No server had on a mask. I understand customers may be eating and not wanting to wear a mask, but literally no one had a mask that was even waiting in the lobby. No one. Okay. This is why the numbers continue to rise. And I get it. It's a complicated process that we are seeing. We have protests going on that are affecting the numbers. Racism is a real public health issue that we must fight. And I appreciate each and every one of you who are stepping out, protesting and demanding that change does happen, because Black lives do matter. Wear your mask when you protest. Protect those that you need to go and take care of. You may need to isolate when you go back home if you're taking care of someone who's elderly or with diabetes or heart failure or respiratory issues like asthma or COPD. Just please take precautions. But there are other problems that we should not be dealing with when it comes to decreasing the risk of exposure to COVID. We should not have to fight this. And that's personal responsibility. Personal responsibility meaning people wearing a mask. Restaurants, stores, anywhere that you are out in public, you should be wearing a mask. You should be practicing social distancing, not coming within someone that you don't know space, because you could possibly expose yourself or have symptoms and not know it, or have the virus and not know it, and spread it on to someone. Personal responsibility. Staying home when you do have symptoms. I have called several people over the last several weeks to inform them that they have COVID. Some of them were at work and they were not working alone. Some of them were in their cars driving to some public place. Some of them were in their home but was at someone else's house. Personal responsibility. These are things that we can control and change, but you as an individual have to care enough about your brothers and sisters around you to stop and stay at home. The death toll from COVID-19 worldwide has exceeded the flu. This is not the flu. We're long past that correlation of thought. COVID-19 exceeds the death toll of malaria worldwide. This is serious. This is not a hoax. Complications of COVID-19 have included heart attacks in people who don't have clogged arteries. We don't see that a lot. People going into liver failure, people going into kidney failure, having to get on dialysis. People throwing blood clots in their lungs. People having blood clots in their blood vessels, blocking off the flow to their legs, ending up having to have an amputation. This is not the flu. This is not like any other virus that we've ever dealt with. Kids, even our dear children, have had severe complications from this with the Kawasaki-like disease that it can affect the blood vessels, causes them to have a very severe rash, fever that's very difficult to break. It's not a hoax. Please, please practice personal responsibility. Wear your mask. Practice social distancing. Isolate yourself if you develop cough, fever, runny nose, shortness of breath, headache, nausea, vomiting, diarrhea, feeling way more tired than you normally do. Isolate yourself. Get tested. Encourage others to wear their mask. Be your brother's keeper. Be your sister's keeper. Thank you.